lots of questions about the cost of dental implants. How much are they? Things like that. So what affects the cost?
So Randy, there's about 8 things that can affect the cost of dental implants, and I have my little cheat sheet here.
All right.
So number 1 is going to be how many doctors are involved. So typically, and the way it used to be done and the way a lot of people still do it, even friends of mine still do it, is that there's multiple doctors involved in this process. They go somewhere to get the implants.
Like an oral surgeon?
To an oral surgeon. They go somewhere else to get the teeth put on. And it makes a lot of doctors that are part of the process. There can be communication errors. So what we try to do is we bring everything into one place. I do everything. Everything is done in my office, so you're not having to go back and forth.
So you do the surgery and put the teeth on top?
Absolutely,
okay.
Yes.
Okay.
And so the next thing that affects the cost is the implant itself. So there's lots of different kinds of implants, hundreds of implant companies, FDA approved, not FDA approved, mini implants, which we don't use. So that's something that has to be factored in to the cost.
Okay.
The next thing that there is the lab bill. This is an expensive procedure from the lab bill side. We are able to print teeth in-house.
So you've invested in the lab?
We've invested in technology to be able to make this process smoother and a little bit less expensive for the patient.
So on the day of the procedure, just so I understand this correctly, on the day of the procedure, you could actually print their teeth in the other room.
Yes.
Digitally.
Yes.
And that's how they get their teeth.
Yep.
So that cuts some costs.
Yes,
obviously.
It cuts some costs. They're not having to pay a lab tech to come in and convert a denture or something like that. We're able to digitally design it and print it in the next room.
Okay, good.
The next thing that can affect it is insurance coverage. Insurance only covers $1,000 to $2,000.
Even with a PPO insurance?
Even with a PPO insurance, and typically not much of this procedure would even be covered under traditional dental insurance. Medicaid, Medicare isn't really going to cover anything.
So what's the answer?
So the answer is financing. We have majority of patients who finance this procedure. We have specialized companies that specialize in financing dental treatment to make this affordable for patients.
But you have to have OK credit?
Yes.
Is that correct?
Yeah, you have to have OK credit, but
you
can
set
have a
this up for
cosigner.
them.
Yeah,
you can have a cosigner.
We set it up. We help them through the process.
Okay. What else affects the cost?
So the next thing is whether those teeth snap in and out or are in there and don't come in and out. So, a snap-in set of teeth is a lot less expensive than teeth that don't come in and out because it's still a denture at the end of the day.
We talked about this. So when you Google like prices or whatever,
yes,
sometimes you'll see these snap-in, these dentures that aren't really what we're talking about today.
Yeah, you have to be careful of what you're looking at because it might look a lot cheaper, but you're not getting an option that stays in. You're getting something that you have to take out at the end of the night. You still have to put it in that cup by your bed.
Okay, what else affects the cost?
So the next thing is going to be the material for the final teeth. So sometimes people use the same plastic, acrylic that they make dentures out of. What we use, we use a material called zirconia, which is the strongest, kind of the gold standard in dentistry. It gives you the most realistic looking teeth while also letting you have the strongest teeth so you can eat what you want. The next thing that have is the extent of the amount of surgery. Not every patient is the same. So some patients come in and they have abundant bone, very easy case. Other people, we're still able to do the case, but it might require special implants placed in positions that maybe other dentists wouldn't be able to do.
Now, we talked about this, and I'll put you on the spot here, but before we, off camera, you're about 30% less than the big guys that are doing implant dentistry.
Yes.
Is that right? That's fair to say?
That is correct.
It's part of like your almost business model?
Yes.
By bringing everything in-house?
A lot of those big guys have multiple doctors. They have expensive lab bills. They're sending out to outside labs for everything. So we're able to have one doctor bring everything in-house and make it more affordable for the patient.
That's nice. So when a patient calls you, because I think you told me they do this, how much are dental implants? It's just not that easy.
It's not
Would
that
you
easy.
say it's misleading even to give a quote over the phone without even looking at them?
Every case is different. And so if I had one set price for every single person, it wouldn't make sense. So we have, we're about 30% less than the big guy.
So even your max price for the best you can get is less than these other guys?
It's still going to be less. It's just the exact amount is hard to tell someone exactly over the phone.
Okay, now what about experience? We haven't really talked about that.
Yeah.
Because does that save people money?
It does. So someone who is quick and efficient at this procedure that isn't taking all day long to do the surgery, they're able to see people and they're able to do the procedure more efficiently and better for that patient, where there's not going to be complications or not the same amount of complications.
You teach other dentists this way of doing things.
Yes.
Is that right?
When I have some free time, I like to go out to Colorado. There's a surgical institute out there, and I help mentor other doctors on this procedure and how to do it well, do it efficiently, and bring it in their office.
In this 3-step process.
In the 3-step process, yes.